Welcome to this training session by Critical Care Psychology team. Today we'll be discussing supporting child relatives of critical care patients, specifically focusing on supporting families to talk to their children about illness and death. We break down the session by looking at the following areas: a brief overview of some of the key child developmental theories, understanding concepts of illness and death, potential reactions at different ages, visiting the unit, and then resources for families and thinking about the resources that critical care can offer and what is appropriate at the initial stages. Child development encompasses cognitive, emotional, physical, social, and educational growth that children go through from birth into early adulthood. Psychologists use frameworks or models for thinking about human growth and learning, some of which might be familiar to you. So, for example, attachment theory. This theory looks at how caregivers, predominantly a child's parents, are being in tune with a child's emotional, physical, and psychosocial needs. They provide a sense of safety, security, protection, which allow young children to be able to explore their environment, to learn and to thrive. Children learn through modelling and what we call scaffolding, that they look to those around them to make sense of their worlds and how to react or how to act in a situation. Social learning theory talks about kind of observation plays a critical role in how a child learns, but this observation does not necessarily need to take the form of watching a live model. Children can also learn by listening to verbal instructions about how to perform a behaviour, as well as through observing either real or fictional characters displaying behaviours in books or films. In terms of cognitive development, there are two sort of core models, one from Piaget and one from Vygotsky. Piaget summarised that there are stages of cognitive development. Development sort of involves internal processes based upon actions and later progresses to changes in mental operations, meaning that there is a difference between the way that young children and older children in terms of the way that they think and learn. Vygotsky's stance takes a sort of broader view that learning is inherently social processes, placing importance on external factors such as culture, people such as our parents, caregivers, our peers, play a more significant role. These psychological models help us to understand that children are not mini adults, and therefore we need to adapt and adjust our communication to help them understand complex and often abstract information that surrounds critical care illness and understanding of death and dying. Children are part of families and wider communities. Therefore, there are many aspects of a child's environment that has an influence on cognitive, emotional, physical, social development and educational attainment. Understanding concepts of illness and death. To help families to inform their children, information needs to be pitched at the right level for them. For very young children, their focus is on what is going on right now, and they have very little understanding of the future and that of time. Their basic needs will be around food, sleep, play, and closeness. Interruptions to these things will have the biggest impact on their emotions and behaviour. They will struggle to understand things that they can't see or touch, so understanding what illness means will be difficult unless they can see it. So, for example, understanding perhaps somebody having a cold by seeing somebody sneezing. They will not understand what causes illness, especially things that go on inside our bodies. In terms of typical reactions, young children may become easily confused or misunderstand things that they hear people say. They may show their distress at change in routine through being more clingy, changes to their toileting, eating, or sleeping habits. They may say things that seem to not make sense to us as adults. They may not understand why adults are scared, worried, or sad, as it's difficult at that age for young children to have that sort of awareness of other people's emotions. They may, and I think this might be quite hard for parents and carers, is carry on with playing even when things around them may be very difficult. So, for example, if somebody is very unwell or has just died, it can be helpful to normalise these reactions for families. So, in terms of advice, it's important for parents not to use complicated explanations. Suggest play with dolls and stories to explain situations or concepts that's important for a child to understand. In terms of the way they communicate the information, using short sentences, and focus on the here and now, so e.g. what's going to happen today and potentially what will happen tomorrow. This works best. It's really important that families should be honest, but don't add lots of detail. Try and focus on, it's important for families to try and focus on their structure and their routine, trying to keep things as normal as possible for the younger child. So as well as sort of trying to give the parents permission to spend time playing with their children. You know, when a family does need to make a change to a routine, it's really helpful to try and keep explanations honest but brief. So for example, mummy is in hospital. This means that she will be sleeping there. In this age range, children are more focused on their immediate environment with an awareness of what is going on around them, what's happening, and how they feel. They may struggle to understand concepts that they cannot picture in their mind, so complicated things like illnesses that they can't see may be difficult to understand. There will be a level of understanding of illness in terms of simple symptoms like a cough, a runny nose, a sore tummy. They may struggle to separate that symptoms of illness may be very different, such as the idea that some coughs are okay and others are more serious. They may be starting to understand that you can catch some illnesses, but they may get confused about this and think you can catch all illnesses. So if a parent has a condition, then a child might interpret that they could catch that condition. They will know that some behaviours can help keep you healthy. However, they might get confused and think it will definitely stop you getting ill. What they might do or say. Children are exposed to stories and fairy tales at this age, and you might hear them playing out illness-related stories with their toys. Some of these things they do may be confusing or not accurate. Children may also fill in the blanks with their imagination or seemingly illogical or inaccurate explanations. You may wonder, where did they get that from? Children may blame themselves or think something was their fault. So e.g. grandma is ill because I did not wash my hands. Carry on with playing even when things around them may be difficult. So for example, when a loved one is unwell or has died. They may also ask lots of questions repeatedly as they try to make sense of information that they've heard with their limited understanding. The use of play and stories can help to shape a child's understanding where necessary and appropriate. Characters in the story can be used to correct misunderstandings. Story and activity books may help children to make sense of what's going on in the critical care environment. So, for example, the ICU Steps Colouring In book, which is available on the unit. Make sure that the child understands cause and effect. So, for example, washing hands will help stop germs spreading rather than it will stop them completely. Parents' answers to children don't need to be complex. Families can repeat information that they've previously given consistently. It can be helpful to say when they don't know the outcome, instead of making something up, or reassure the child that everything will be fine. So for children, it's really important to help them label their emotions. And parents can be really key in this. But I suppose for parents, it's knowing how they're feeling at that moment in time to be able to then support their child in terms of labelling and naming their emotions. With this age range, children can now see themselves as different to others and understand that other people have different needs and perspectives. Children still think about things from their own perspective and so will be influenced mainly by that.
But they have an understanding that illness can be lots of different symptoms and that lots of things can go on inside their body which they can't see. They're also starting to develop that understanding of time and concepts of time and permanence, and that will understand that death happens to everyone and that it is permanent. What they may say or do. So not wanting to voice concerns for fear of upsetting parents, friends or others. They might find it difficult to verbalise their distress. They might not know why they feel worried or stressed or how to label that emotion. They're more likely to experience stress as a physical symptom like a headache or a tummy ache or wanting more physical contact. And they may ask more questions about the impact on other people or wider changes to life than younger children. So parents could encourage emotional expression through drawings, stories, questions, feelings box where children can write down their questions and thoughts and discuss with an adult can be helpful. And parents or wider family members could encourage children to draw their loved one a picture or a card that they could then hand to the nursing team. Normalising those different feelings appropriately and talk about what they are doing to help with their worries and feelings. To encourage children to be active, provided that they are also well. This gets rid of some of the chemicals in the body which are released when we were anxious and will help with physical symptoms of stress. Make sure children don't take on adult roles in a desire to help others, and ensure explanations are accurate and explain the difference between conditions. For this age range, children have a good understanding of time. They can imagine the future and lots of possibilities. As a result, their imagination may mean that they're able to worry more about things that haven't happened or might not happen. Teenagers can understand the different causes of illnesses, that illnesses can be very different, and can understand the role of stress and worry on the body. They are still mainly influenced by their friends, so even though they can understand a lot of information about illness and what their friends and cousins and colleagues are doing and saying may impact on how they behave. Teenagers are developing their own identity and a sense of who they are in the world. They're likely to look at their own sources of information, and parents become less defining in how they think about information and how they behave. In terms of what they may do, say, or behave, they may ask less questions. They might ask less questions from their families. They may turn to other sources of information, such as social media, their friends, and Google. They may take advice from friends or other social influencers on how to behave and act, and be conscious of not wanting to act differently. There may be increased awareness of how illness and health behaviours fit with and what's important to them. They might be more concerned with social, moral, and emotional aspects of illness and how illness is having a broader impact. This might lead to more distress and sadness than in younger children. They might want to find ways of helping others. So it's important for parents and the wider family to continue to offer space for support, affection, and discussion. Ask open questions such as, what did you think of the news that? Or what did you take away from the consultant's update today? Make sure that information is reputable. So at NHS website or ICU steps. Support social opportunities and discussions with peers. Offer choice and promote independence within the context of what is possible and appropriate. And suggest ways of helping others that are safe and appropriate. So these points, I suppose, are universal to any age of child or young adult. And I suppose they're sort of if you like, the golden rule of that, it's really important that children, young adults are informed of what's happened straight away, whether that's an illness, an accident, or a death of a family member. They should also be updated and kept in the loop, and using age-appropriate language as already discussed. Where possible, for families to try and keep the children, the young adults, routine as normal as possible. and encourage family to link in with nursery, preschool, school, and let them know what's happened. This is really important because actually these organisations tend to know children, these children really well, and so when they see that they are acting out of character, more withdrawn, more distressed, perhaps more angry, frustrated, that they're able to kind of interpret this, knowing what's going on for the child or the young adult, and they can offer support appropriately. A lot of certainly school and secondary schools have emotional wellbeing support and or school counsellors, and these might be really appropriate really appropriate ways of supporting a child, especially during the early stages of coming to terms with a critical care illness, a loved one in the critical care, and the uncertainty around their illness or a death. Visiting the unit. At times of distress and uncertainty, parents or family members may look to us to help make the decision of whether it's appropriate for a child or a young adult to visit their loved one on the unit. This isn't a straightforward answer, and there are many questions to be considered. So it can be helpful to think about what is the prognosis of the adult they're visiting. How is it appropriate? And in terms of is now the right time, or could the visit be delayed? How will it be helpful for the children, or will it be helpful for the children? So these are really important questions for us as professionals to be thinking through in terms of guiding and helping parents and family members to come to their decision. I think it's also really useful for us to take some time to talk through with parents and family members about the concerns for the children. Often they really worry about getting it wrong and sort of potentially that fear of making something more traumatizing or denying the opportunity of seeing a relative, especially if they then die. So there's sort of things that I think are sort of really helpful to think about in terms of how old are the children, what do they know already, what questions are they asking at home, how are they expressing themselves, so is there a change in their behaviour or sort of their are they withdrawing into themselves? Are they asking lots and lots of questions and needing to know answers? And that in itself is kind of really tricky for the family member. I think it's also really helpful to think with the family, who's around supporting them, and what and how they might react and cope with the unit's environment. So thinking about the environment, the unit can be a very scary and sort of frightening or overwhelming environment for our patients, and also, we know for our adult visitors. So I can think it'd be really helpful for us to kind of think about how it would be viewed through the eyes of a child or a young adult. I think it's helpful to encourage parents or family members to think about kind of preparation. So preparing the child or the young person to come onto the unit, and there's a number of different ways that we could suggest that might help. So for sort of the younger children, the ICU steps booklet that I've mentioned before could be a starting place. So in that has appropriately levelled descriptions of equipment that you might find around the bed space, and it's sort of interactive in the sense that children could colour that in. So that might be a way of introducing some of the equipment that they might see when they come onto the unit.
It's also helpful to think about, the route to the bed space. So potentially what would a child or a young person see, and how could we normalise that? Sometimes children are just very focused on getting to their relative, and perhaps they don't take in that information, whereas others might be scanning the environment, taking in all the sounds, the sights, seeing patients that are critically unwell. Perhaps they're making unfamiliar noises, which can be scary or sort of quite intense for children. I'd also be thinking and asking the parents or the wider family around the children, has the child had the opportunity to FaceTime their relative? Has video calling taken place? Is video calling or FaceTiming a way that could support the child to see their relative, but without necessarily needing that child to come into the hospital environment? So that could just be something that is worth talking about and thinking through with parents and carers. If a child is regularly FaceTiming a parent, then you could perhaps suggest delaying a visit and thinking about, is it more appropriate for the child to come into the hospital environment when their loved one is being stepped down onto a ward, or able to have visitor, go down to concourse and see visitors in that way. Sometimes it might be appropriate that a picture is used of the patient instead of an actual visit, and again that might be something that might be helpful to talk through with the medical team and perhaps psychology. And like I said, just making sure that children feel really prepared for what they might see, the sounds, other sick patients, and where in the unit they'll be walking to. And also what PPE might be expected of them and what that might feel like, and how it's important to wash their hands before they go onto the unit and coming off the unit. Really what you're trying to do is kind of walk them through step by step, so it prevents the imagination taking over, and so everything feels very clear cut, and very clear cut and very supported. It can be really emotive, supporting families to support their children when such an event has happened, and there are many very good resources that the team can signpost people to. In terms of critical care specific resources, on B3 Corridor we have helpful leaflets which can be given out to families, summarising some of the information that we've already covered in this PowerPoint. ICU Steps Colouring In book. This can help younger children to make sense of some of the equipment and how their relative is being looked after. We also have an overview of supporting children leaflet, which gives some general information. We also have books to help start to make sense when somebody dies unexpectedly. This has an adult book which accompanies the child book to help the reader navigate through some of the material and also any potential questions. We would also recommend the ICU website, as this has some helpful resources for parents and family members. And again, we would also recommend the Winston Wishes website, as they have a list of books and resources which are divided down into sort of age appropriate. When there has been a bereavement, it can be very distressing for all, and families are trying to navigate their own emotional responses and grief, as well as supporting the children. We all grieve very differently and have very different reactions, and this will be the same for children and young adults. Thinking about the earlier slides, that young children may not take in that information, and they may continue to play and do what they would normally do, whereas older children and young adults are very much more aware of the reactions of others and that sort of permanence that death brings.
There are two excellent websites that can help parents and families navigate these early days, especially looking at sort of telling children when somebody has died and normalising those early grief responses through to perhaps resources that they might need further down the line in terms of more of that adjustment around that loss and that bereavement. There are other bereavement services such as CRUs that can support adults and children. Some services will offer bereavement counselling, but this tends to be offered further down the line, perhaps a year or 2 years later, when somebody has had that time to naturally process that loss. So if we think about grief is a very normal, it's a very appropriate, it's a very healthy emotion or response, and we all need to work our way through that initial grief. There is no set timeline, if you like, for grief, that grief should be over within 6 or 7 months, and I think it can be really helpful to normalise that. We all need to work through and grieve in our own way and our own time, but sometimes people do feel that it would be helpful to have that support, and that would be something that we would recommend happens much further down the line rather than that initial during this initial phase when perhaps somebody is leaving the unit or is starting to or waiting for a coroner's report or is sort of in that sort of planning the funeral stage. You know, death is part of the critical care unit, and I think there are some deaths where it's so much harder to make sense of them as a staff team because of the impact that perhaps it has for the family, especially when there are children and those children have been on the unit, or the family have been talking about the children and the impact on them. And so I think it's really important to acknowledge that that sometimes these deaths sort of touch something within ourselves. Perhaps they tap into our own experiences or our own losses that we've had, and it can be really important to support each other, but also to know that there are services that can support us as individuals, as professionals working in this environment. So tapping into our staff wellbeing service, if that is something that you feel would be really helpful. Also that kind of going through this sort of TTM process might be something that as a staff team would be really helpful, and having that space to think about the family and everything that the unit did to ease them through such a very difficult time, and that can be arranged with Dr. Julie Highfield, consultant psychologist for critical care.